Counting down.
Hello, my name is Rebecca Bullingham, and I'm here today to talk to you about some research we have done throughout 3 phases, looking at clinical supervision for nurse and pharmacist independent prescribers within primary care in Wales. So a few statistics from 2020. Approximately, there was nearly 48,000 nurse independent prescribers, 9,000 pharmacist independent prescribers, and one health board in Wales averaged 34% of their prescribed medicines being from independent prescribers. So what do we already know? We know that there is insufficient clinical supervision for independent prescribers, particularly within primary care. We know that clinical supervision is poorly defined across the board, and a lack of clinical supervision is a key barrier in prescribing. So that is those who are already prescribing, it is preventing them wanting to extend their scope of practice, and it is stopping clinicians wanting to become independent prescribers. So the aim of this research is what is needed from clinical supervision sessions to support independent prescribers in their role. And to do this, we used a 360-degree perspective, looking at the perspectives of supervisees, supervisors, and key stakeholders of independent prescribers in Wales. And we used 3 studies to explore this phenomenon. There was no patient or public involvement, as the focus on the study was purely what the practitioners need out of clinical supervision sessions, although the hope is the outcomes may improve clinical practice and patient care. So the outcomes of the study were all based on the 3-phase participant involvement. So phase 1, semi-structured interviews with independent prescribers working in primary care. And we explored the perceptions of effective clinical supervision. So what does that look like for the independent prescriber or the supervisee? What does effective clinical supervision look like? And have they encountered it? Is it something that they would like to encounter? And those findings were used to develop a survey to explore this phenomenon further. Phase 2, a 2-stage Delphi survey, round 1 exploring the purpose, characteristics and structure of clinical supervision, and round 2 exploring the structure and characteristics. 13 statements met consensus in this study, and it informed the development of the informed model of supportive supervision. And phase 3, we looked at key stakeholders and the supervisors of independent prescribers. We explored their perceptions of the model that we had created based on phase 1 and 2, and also explored their perception of the governance of independent prescribers in primary care, which was also highlighted as an issue throughout the 2 phases. And these findings informed the slight amendments of the model. So the key findings in this study, that independent prescribers felt competent in their practice, and the wider evidence would also support this. Without adequate support, their confidence was affected, which led to a reluctance to prescribe and or to extend their scope of practice. And more worryingly, it led to a reliance on other prescribers to certify their competence. The development of a model of clinical supervision was created and informed by the supervisees, supervisors, and key stakeholders involved in clinical supervision. So the impact of this study, the TIMS model is already being used in some health boards, and within those health boards, it is widely being used in practice. So further research would be very beneficial to evaluate the use of the model. How has it been for practitioners? How have they benefited from it? And hopefully, how will that result in improving patient safety? This is a copy of the model. I'm happy to receive any correspondence in regards to this to explain it further. I don't have much time in the 7 minutes to go through it, but essentially it's a very flexible model. It can be used from anybody, starting from the first stages of prescribing. So as soon as people start prescribing, and also very experienced prescribers like myself who have been prescribing for 11 years, it is applicable across the board. And that's it. Thank you very much for listening.